Oh, sorry, bumped you. Hey everyone, Dr. Alex Ritza, downtown neurostructural chiropractor, and this is our team leader, Jess.
Hi.
Everyone say hi to Jess. So this is episode 19 of Lunch and Learns with me, Dr. Alex, and today we're going to continue our Headache Awareness Month. We're going to talk a little bit about headaches as it relates to the neck, and we're just going to show you part of our neurostructural examination that we do. And we're going to look at our advanced palpation examination and look at when we look at Jess's neck and when we assess it. We're going to see what we feel today, tell you a little bit about what we're looking for, and before we go ahead and make any corrections on Jess, which is going to happen off camera, I just want to talk a little bit about what happens here so that there's nothing scary, let you a little bit behind the curtain. I think it'll help a little bit more awareness of how things should feel when you touch your own neck, and if something is really sore, is that normal? So part of our neurostructural examination is always going to look at and see how the joints of the neck and the joints of the spine are moving, and seeing whether they have the proper amount of motion or whether they're shifted. And not every shifted joint is going to be sore. In the same way that you could have something going on in terms of heart disease or a health problem, and it can build up, and then it hits a threshold where it's symptomatic. So there's the point where we're going to know that something is shifted, not moving well, but also the point where it's shifted, not moving well, and really, really sore. So normally we would do this with Jess on her stomach, but we're going to do it seated today for filming purposes. So when I go to examine Jess's neck, Jess, I'm just going to put my hand on your forehead, and you can just let that fall flat there. So nicely supported, and what we're going to do is we're just going to feel the joints of the neck, just seeing how much spring they have. And so I'm just seeing if they're sitting in the right position, seeing if they're a little shifted, and seeing if they've got a good amount of spring. So I'll show you Jess's facial expression. When I touch that spot, how's that feel, Jess?
Not great.
Not great. And then this one up here at the top of the neck, also not lovely. And then Jess, when I press that spot there, how does that feel?
Not bad.
Yeah, so when I feel to my fingers, the joints at the bottom of the neck, they have a good amount of, I'll get a little bit closer to the camera. They have a good amount of spring at the bottom of the neck, and then at the top of the neck when they're not moving well, I press them and it's like pressing a block of wood. And when I feel that block of wood sensation, that tells me that that joint is not moving well and not moving properly, and it's a bit shifted, and in some cases a bit irritated. So we'll check the other side of Jess's neck. So let that just fall forward. And when I press there, that one does not move at all. And Jess, how's that feel?
Not good.
Not great. And Jess, when I press that, does that go up to your head at all?
No.
Okay. So sometimes, if you ever place a finger gently at the base of your skull, so you follow the skull and you can kind of reach up underneath to touch the suboccipital muscles. If you press there, sometimes you might notice that travels up to the head or to the back of the head. I'm calling something that headache type referral, and we would call that a cervicogenic headache, or a headache coming from the neck, and that's just a referral from those suboccipital muscles and the first joint in the neck. And if you have that even from pressing yourself, that's usually an indicator that there's a core problem with the spine and nervous system that needs addressing. One last thing that I'll check with Jess, that's always part of our examinations, and we also want to see how the head's sitting on the neck. So Jess, I'm just going to hold the head nice and easy like that, and we're just going to try and do a nice little scooping motion. Okay, that moved well. And then that one's a little bit more stuck, but both sides, not too bad. That skull or the occiput is sitting nicely on that first joint there. So just a big shift up here at the top and C1 that we're going to take care of. So whenever we are assessing the neck, we're always looking to see primarily how things are moving. Pain, yes, it's important, it's a good indicator of how irritated something is, but it all comes down to movement and function. So if you notice that you touch certain spots on your neck and they are a little bit sensitive or a little bit painful, that's telling us that not only is that joint probably not moving well, and it hasn't been moving well for a long time, because it's to the point where it's at that pain threshold, and it's likely something that needs to be corrected. But it all comes down to going through a proper assessment to see if it's in need of a correction, or if it's just something normal that's part of your body. So this is going to be our last video for our Headache Awareness Month. I hope that you guys have gotten lots of value out of the posts that have come out of it. I hope you all have an amazing week. I'm going to take care of Jess right now, and we'll see you guys next week for Lunch and Learns with Dr. Alex. Bye, guys. Thanks, Jess.